Okay, good morning, everybody. I think we're going to get started. Thanks for everybody's patience. We are down one speaker today. Director Liu had an unscheduled conflict, so we are down to 5 speakers, which is plenty. Wonderful speakers. First speaker we have is Colonel Matthew Packard from the Colorado State Patrol. Then we're going to have Skylar McKinley from AAA. Then Ned Kalange from the Colorado Department of Public Health and Environment. And then Rebecca Green and Clara Shelton from Mothers Against Drunk Driving. The topic of the conversation today is traffic deaths on our roadways, where they're going and where they've been. The good news is we are seeing our second year of decline in traffic deaths in Colorado. At this point, I'm going to bring up Colonel Matthew Packard to tell us a little bit more. Thank you.
Thank you very much for being here again. My name is Colonel Matthew Packard. I have the privilege of serving as the chief of the Colorado State Patrol. And this is an event that we do every year that I both look forward to and dread the fact that I have to come back in front of this body of people and share that yet again, hundreds of lives have been lost on Colorado's roads. And in fact, in 2024, that number today stands at 681 lives. 681 people that left their home in a car, or on their bicycle, or walking, or on a motorcycle, that some event happened that caused them to not arrive at their planned destination, whether it's the grocery, school, the dinner table with their loved ones, or their work. That impact is not only to the family, to the people, but it is so broad across the spectrum of what makes Colorado, Colorado. And there is so much more that we can do to save these people. Women of the Colorado State Patrol will continue to work as hard as we possibly can to increase the safety on Colorado's roads. And what that means to all of you is that we will do everything we can in every moment to save lives, and so that everybody gets home to the places and gets to the places where they want to be. The good news, as Sam referenced, we have seen a decrease in fatalities in 2024 as compared to 2023. Just under a 6% decrease, as a matter of fact. Last year, that number landed, in 2023, that number landed at 720. But I do reckon back to a day conference in 2020, where we talked about having that number being below 600 in the year 2019. And as you'll hear today, that our efforts at the patrol are aligned with CDOT, our policing partners, and so many of our other partners in this space to get that number back down below 600 and continue our efforts to actually drive that number all the way to 0. You'll hear from several of us today about different areas of focus. I know that we've seen increases, particularly in roadway construction zones, and I know CDOT will talk about those specifically. I know we have partners from MAD and AAA, but I really want to highlight 2 areas of particular interest for us here at the Colorado State Patrol. And the first being, we saw a stark increase in the number of motorcyclists that lost their lives. In fact, 19% increase in motorcycle-involved fatalities in 2024. I get a lot of questions about what the causes of those crashes are and how, the mechanics that go into that. A couple key factors for us that we identify. 44% of the people that died on a motorcycle were not wearing a helmet. And while I certainly respect one's ability to make that choice, the math is really simple. The data shows it. If you wear a helmet, if you wear protective gear, your chances of surviving that crash are far better. And from my experience, when you look off that motorcycle through a helmet, the view here in this state is just as good as if you're doing it without. And hey, live to ride another day. It seems like a really easy decision to me, and it's a way we can have a significant impact on saving lives on Colorado's roads. But the actual mechanics of the crash come up frequently as well. But I'll tell you, it's not all that different than what we see in 4-wheeled vehicles as well. What causes these crashes being excessive speed, careless and reckless driving, and also just plain old inattentiveness. Those should sound familiar to many of you. That's what causes crashes in our state and has consistently done so. One unique thing for motorcycles, however, is rider inexperience. In fact, when you really look into our data, we see this, what seems to be folks that maybe rode in their younger days and then are off a motorcycle for a while, tend to not keep up with the ability of the motorcycle that they're riding. But we have solutions for that too. Again, it's a reminder to protective gear. But the state is also involved in providing training opportunities. And there's 1 or 2 day training opportunities available for people that want to ride motorcycles. There's beginning classes. It's all through the Colorado MOST program. And if you go to comost.com, you can find access to motorcycle training around the state that will provide riders with a little bit of extra experience and knowledge on how to ride and navigate the roads in Colorado more safely. And there's no doubt that mountains in Colorado are a beautiful place to ride on 2 wheels. We just want you to do it lawfully, safely, and in a manner that you can live again to ride another day. I'd also like to highlight impaired driving, and you've heard me talk about this particular topic certainly in the weeks past, if not for the years past. But the Colorado State Patrol in particular is going to lean really hard into solving this impaired driving problem in Colorado. In fact, our commitment is to work to reduce fatal and injury crashes in Colorado that are caused by an impaired driver by 15% in the year 2025. So how are we going to do that? Number 1, you'll see visible enforcement from our organization. We'll continue to work hard to do public safety service announcements. We'll provide education to the public that are interested. We'll do our best to provide training and opportunities for more experience to not only our troopers, but our partners in policing across Colorado as well. We've got a big gray van that we can put an intoxilizer in, and we'll drive all over the state, and we will continue to prioritize hosting multi-agency enforcement efforts around the state, specifically to target this impaired driving campaign. But I'll tell you this also, this won't be a surprise. You're not going to find a patrol car or that DUI van parked around a blind corner trying to surprise you. Every time we do this, we are going to be out and up front. We don't want to have to arrest anybody. Our much preferred option is that you make a plan. Use a ride with a friend, have a designated sober driver, find some other way to get home besides becoming impaired and driving yourself. That is not a healthy option. It is in fact a deadly option. And we continue to see a number around 30%, about a third of the people that die in this state are at the hands of an impaired driver. And I believe there is no better opportunity for us to lean into than solving this problem to save a substantial amount of lives on Colorado's roads and by solving this issue. You just do the math. Even at 600, that's 180 lives we can save by stopping people from driving impaired. So again, I thank you very much for the opportunity to be here. But this is one of those problems that we continue to talk about every year. We're making progress in the last 2, but now is the time to really put our pedal to the metal, if you will, and do everything we can to make people safe on Colorado's roads. Thank you very much for the opportunity to be here, and I'll turn it over, Sam, to the next speaker, Skylar McKinley from AAA.
It's nice whenever I follow Colonel Packard, I normally have to adjust the mic, but there is no mic. So, hi, I'm Skylar McKinley. I'm the Regional Director of Public Affairs for AAA. As it happens, I'm a driver, I'm a pedestrian, I'm a motorcyclist, I even own a little saloon. I really understand all aspects of what we're dealing with here. And I would say that it is tempting, as we stare down the barrel of 681 deaths, to say things are going wrong on Colorado's roadways. And there's a lot going wrong. These tragedies are preventable. But I want to take a minute to pause and say there's a lot going right here. In the first place, thanks to a lot of folks in this room at CDOT, State Patrol, and others, fatalities are trending in the right direction, from all-time highs to a situation where now the Colorado legislature is taking very seriously traffic safety issues, where we're talking about these issues every day, where we emphasize personal responsibility. Last year, as I mentioned, was one of the most productive legislative sessions I've seen in my decade of doing traffic safety in Colorado. I think there's more to come on that. I could also hop on a bus right now and end up in Craig or Grand Junction or Durango. They tell me there may be a train to Oak Creek someday. These are safer modes of transportation. We should emphasize over the automobile. Communities across the state are adding robust bicycle and pedestrian infrastructure. And look, nobody likes traffic, but our goods and people still move fairly quickly across our state. And if you don't believe me on that, ask somebody from California, New York, Maryland, wherever. So what work? This is the other emergency responders, our technicians, they keep our drivers and therefore our economy moving. Our road crews at CDOT and with local partners, without whom there would be no infrastructure to move around on. Of course, law enforcement officers and other first responders whose call to public service regularly exposes them to life and death risks at the roadside. Here's the problem. I know all of these people. We know all of these people. We talk about these people. Drivers don't notice these people until their sacrifices cause a news story or until there's a problem. It's one of those old phrases where you don't miss your water until your well runs dry, right? That has really tragic consequences that I see play out at work every day. Mere days after we wrapped up the Western Colorado Transportation Symposium in Grand Junction last year, CDOT's Trent Umberberger and Nate Jones were struck at the roadside just a few miles away. We had literally every traffic safety expert in the state in Western Colorado for this. 2 days later, we lost 2 CDOT road crews because folks were failing to abide by the state's robust and straightforward move over law, right? Last year, Colonel Packard will tell you, 11 state troopers were involved and struck by incidents while they were responding at the roadside. If you talk to my guys at AAA, luckily, we had a year last year where we didn't lose anybody, but they will tell you there are near misses to the hundreds on a weekly basis. A millisecond is really the only difference between a near miss and a strike and kill, and that strike too often keeps a technician from coming home for dinner. Folks in these lines of work at all times hear Coloradans thanking them for their service, but when it counts, when you're actually behind the wheel, too many people ignore the laws that we've passed to keep these people safe. So here's my ask for today. Every time you interact with our transportation system, remind yourself who makes it work. The people, the lives, their families. Every time you're frustrated with it, ask yourself how your behavior can endanger the folks without whom you'd be trapped at home. You thank other people in everything that you do. You thank the cashier at the grocery store, the barista at Starbucks. You can't often thank folks who work at the roadside because it's so dangerous, and that's a good thing. They're out there taking that risk so you don't have to. But you can thank them by thinking about them and driving accordingly. I want to conclude with just a couple announcements. By dint of a new partnership we have with Waze and with Google, our data now at AAA is going directly into their navigation systems. We're sharing APIs, we're sharing data. So if you're a AAA member and you request service, that's going to flag Google, it's going to flag Waze, and every driver on that route who's approaching you is going to get a notification saying, hey, look out, there's a disabled motorist again. This doesn't require drivers to type anything to their phone. It's going to happen whenever somebody makes a call with AAA. Relatedly, that alert is going to change the second one of our technicians arrives on scene. It's going to tell drivers, look out, there's a roadside technician ahead, there's our member ahead, slow down and move over. That's the law in Colorado. Finally, we've invented a new device, a new piece of technology that will alert our roadside heroes whenever a vehicle has crossed into the shoulder and is verging on them. That's going to give them an extra couple milliseconds to react. We're testing that in Colorado. We're testing that on Colorado roadways in line with Colorado weather conditions. I will have some results and that device to share, I think, later this year. And we're excited about it because, again, just letting the driver know a car is when their back is to traffic can mean the difference between life and death. So that's all exciting and that's good news, but these advancements only really matter if people care enough to do the right thing. And so while I've avoided fire and brimstone, we're still talking about 681 fatalities last year, right? My partners in state government probably can't say this, but I think 2025 needs to be the year that we all decide to care about these people, about our roadside workers, and about each other. And I will say this, and you can quote AAA on this, and I'll probably get an angry email from my boss, and I'll deal with it. My message to you is if you don't care, if you only care about yourself, stay the hell off our roadways. We don't need you, and we don't need to lose these lives. Thank you.
Hello, everyone. I'm Ned Kalange. I'm Chief Medical Officer for the Colorado Department of Public Health and Environment. And we feel so honored to be asked to present at this really important conference to celebrate the successes and look forward to ongoing reductions in motor vehicle fatalities across the state. We recognize that traffic safety is an important public health issue that impacts all Coloradans. Whether we're walking, driving, riding a bike, or using a mobility device, the ability for us to travel safely in our communities and across the state impacts our health, our education, and our economic well-being. Safe roads and highways allow us to travel to work, take our kids to school, meet with friends, walk to parks, or simply go to the grocery store and get food. Integrating public health into transportation safety efforts to advance population-level injury prevention is getting more attention and more traction throughout the country. We are working with the Colorado Department of Transportation and their many partners across the state to advance the safe system approach, which is a public health approach to roadway safety. Public health approaches involve using data, applying proven strategies, and interacting and working with communities And these approaches are very individual and group behavior changes in terms of health and how people interact with their environment and with others. The system approach offers greater opportunities to have more and lasting change. We use the safe system approach to better understand the environmental and societal factors that are associated with roadway deaths and the preventive interventions such as adding sidewalks and additional lighting to prevent pedestrian deaths. We also work to prevent substance misuse and impaired driving, which you heard about earlier. Reducing substance misuse can reduce roadway fatalities and serious injuries. They also positively impact mental health. They reduce community violence and many other health and safety outcomes. At the local level, CDPHE has been working with 2 local health departments with grant funding to implement community-led strategies to prevent impaired driving. We're working directly with El Paso County Public Health and with Fremont County Public Health. These departments are using input from their communities to build public awareness campaigns and build momentum to address behaviors and make our communities safer. This work is an excellent example of how public health can have an impact in the area of roadway safety. We also work to increase safe, active transportation through the state physical activity and nutrition program, which is sponsored by the CDC. Through this work, our partnership with CDOT on programs such as Safe Routes to School promotes physical activity and encourages local communities to implement both built environment and safety strategies designed to reduce death or serious injury for Coloradans' vulnerable individuals, such as people walking, using wheelchairs, or riding bicycles or scooters on our roadways. Increasing transportation safety for vulnerable road users is critical to assuring that all Coloradans can travel safely through their communities. Now, we know that some communities are disproportionately impacted by environmental and health burdens, meaning they experience more than their fair share of the negative impacts of traffic risks. We have the Vulnerable Road User Safety Assessment, which overlaid crash information with our EnviroScreen tool, which is a measure of a lot of environmental and health impacts in a single space. And we're able to find that there are some communities that are 2 or 3 times more likely to experience issues with traffic safety and pedestrian deaths. So there are a lot of ways we can use public health approaches to address road safety and work closely with our CDOT partners. I couldn't be a public health official without underlining what you heard earlier about motorcycle helmets. These are proven strategies to reduce one of the areas that we know is of serious concern in Colorado, and I really appreciate the State Patrol's underlining that important issue. We celebrate the partnership with the Department of Transportation in addressing safe travel throughout our state, and we really appreciate being part of today's event. Thank you very much.
Good morning. I'm Rebecca Green, State Executive Director for Mothers Against Drunk Driving Colorado, and I'm honored to be here alongside many of our partners as we work to save lives in Colorado. MAD's mission is to end drunk driving and drugged driving, support the victims of these violent crimes, and prevent underage drinking. Drunk and drugged driving crashes and the resulting injuries and fatalities are devastating to our community and entirely preventable. In 2024, Colorado saw a 9% decrease in impaired driving fatalities over 2023. And while that number is promising, 207 locally, many more nationally, 2007 lives were lost because of an impaired driver last year. 207 families and communities have been forever impacted, and MAD is here to support and continues to support those families at no charge. But until that number is 0, there is more work to be done. It's 2025, which is hard to believe, and 45 years ago, 2 moms stood up and shared their story, and families came out of the woodwork to share that they too had been impacted by impaired driving. That's 45 years of us asking people to make a different choice. Now, if that worked alone, I'd be out of a job. So in an effort to prevent impaired driving crashes and invest in the future of traffic and community safety in our state, MAD Colorado is expanding an internship program for college and university students, engaging them in the entirety of the DUI process. Thanks to a grant from CDOT's Highway Safety Office, MAD is offering students the chance to learn about the full impact from arrest to sentencing and beyond. They learn everything there is to know about DUI: data, wet labs, ride-alongs, all of it, even the victim experience in court. They gain exposure to the true human cost and the ways in which we can all advocate for change so that this message, this issue can carry on until it really is 0. We continue to look for innovative approaches to prevention because we know that we can end impaired driving. I'd like to welcome MAD National Ambassador and MAD Colorado volunteer Clara Shelton to share her story and her advocacy for innovation to save lives and end impaired driving.
Thank you, Rebecca. As she said, my name is Clara Shelton, and I'm a MAD National Ambassador and volunteer with MAD Colorado. A decrease in fatalities is really good news, but there will always be work to be done until, like Rebecca said, that number is 0 and everyone who goes out on the roads comes back safely. And I'm here today to remind you that every number you see in these statistics about traffic fatalities represents one real life, one real person who had a family and friends who will never be the same in their absence. My brother Sam was an 18-year-old college freshman at CU Boulder in the fall of 2015. He had been a bit of a wild child as a high schooler. He had skated by on just passing grades, and he turned my mother's hair gray with his antics, though he always managed to make her laugh while doing so. But in college, he was a new person. He was excited about his classes, motivated to do well, eager to join clubs, make friends, and set himself up for success. And even in just his first 3 months in school, my whole family could recognize the change, and we were thrilled to see it. But on that night of November 15th, a Sunday, all of that came to a sudden halt. He and 3 friends were driving back to campus, all wearing their seatbelts, and they were about 20 minutes away from CU Boulder on Highway 93. A drunk and drug driver came hurtling at them way above the speed limit. Another driver on the road told 911 that he had seen what looked like an explosion. The other 3 kids in the car were thankfully okay. Sam, who had been in the passenger seat, was not. He was airlifted to the hospital in Lakewood. He was sent into multiple surgeries, and he remained in a coma for the next 73 days. We never heard him speak or laugh again. He died in January of 2016. My family and I recognized the 9-year anniversary just last Sunday. 9 years is not enough for us to forget the impact he had on our lives, which we will never forget. For those last 9 years, I've been volunteering with MAD because it feels like the best way to honor Sam's legacy. My greatest dream and wish is that no other family would have to go through what we've experienced. And it seems like a tall order, but it doesn't have to be. Impaired driving is a 100% preventable crime. Beyond the obvious way to prevent it by just not doing it, there is so much progress being made by MAD and its partners to stop this crime. A few years ago, I was honored to be part of a team at MAD that helped pass the HALT Act at the national level. The HALT Act directs the federal government to require all new cars come equipped with smart technology that passively, seamlessly, and unobtrusively detects and stops impaired driving. This is technology that already exists that car companies could implement at any time if they wish to be part of the effort to prevent impaired driving. The HALT Act was an incredible example of bipartisan collaboration and it was signed into law as part of the infrastructure bill on November 15th, 2021, 6 years to the day from my brother's crash. The bill gave NHTSA 3 years to set the safety standards for this regulation. That deadline came and went in November of last year. Every moment that these regulations are delayed, punted, or ignored is a moment when we are losing people's family members on our roads. Every 78 seconds, someone is killed or injured by drunk driving in America. While I continue to join MAD in pushing our federal agencies to follow through on their commitments, I'm always encouraged by what we can do right here in Colorado. Every legislative session, MAD and our partners works hard to enact change at the state level, ensuring we have adequate funding and resources to prevent impaired driving, support those who are out there fighting it on our roads every day, and provide comfort and resources to victims and their families. Thank you for your efforts in making our roads safer, and thank you for remembering the real human impact behind every number. If you'd like to get involved with MAD, please contact us at co.state@mad.org, or just come talk to us. Thanks.
Okay, so that concludes our press event. I'm going to stick around for a few minutes on behalf of CDOT. I'd be glad to do any